Hi everyone watching. This video is about borderline personality disorder, or BPD for short. My name is Shannon Wheeler and I'm a master's student in clinical counseling at Alliant International University. So we're going to discuss today what BPD is in general, what its prevalence is, how it is treated. We will look at it from a cultural standpoint and we will consider any ethical implications involved with diagnosing and treating BPD. So what is BPD in a nutshell? Oh, how did that meme get in there? Okay, let's see. All right, that's better. So borderline personality is a disorder characterized by instability, extreme emotions, and impulsivity. This might sound a little bit like bipolar disorder, but where people with bipolar disorder have shifts in mood over the course of days or maybe months, people with borderline personality disorder have extreme shifts in mood within hours or maybe even less. Because of their intense feelings and sensitivity, people with BPD have an extreme fear of abandonment and will go to excessive or maybe even unreasonable measures to ensure that they feel that they aren't in danger of being abandoned. This impulsivity often leads to a lot of instability in their relationships. This quote is by Sylvia Plath. Even though she wasn't officially diagnosed with BPD, a lot of people on the internet with BPD say this quote really resonates with them. It is as if my life were magically run by two electric currents, joyous positive and despairing negative. Whichever is running at the moment dominates my life, floods it. So you can see that it's very difficult for someone with BPD to manage their everyday emotions. So the estimates are that 1 to 2% of the population has BPD. This also may be underdiagnosed, but it's a fairly new disorder, so people are still learning how to properly diagnose it. Now we'll explore the official diagnostic criteria set forth by the American Psychiatric Association. The DSM-5 has 9 possible criteria to diagnose BPD. Someone with BPD will show at least 5 of these 9 symptoms. All right, so number 1 is frantic efforts to avoid abandonment. This could be perceived abandonment or real abandonment. For example, imagine a friend is running late to dinner. Someone with BPD may experience super strong anxiety and believe that this person is going to leave them forever. It may not be reasonable or real in real life, but the fear is very strong and the fear is real to them. The second one is unstable interpersonal relationships. Someone with BPD will likely alternate between extremes of being strongly attached and infatuated with someone to being completely devaluing of them. And this is not exclusive to romantic relationships. This is true of all of their relationships. The third is unstable sense of self. People with BPD may not feel that they know what their true identity is. They may feel that they do not fit in anywhere. 4 is damaging impulsivity, such as spending, risky sexual behavior, substance abuse, bulimia, or reckless driving. 5 is recurring suicidal behavior. They might say something along the lines of, if you leave me, I will kill myself, or other normal behaviors associated with suicide. 6 is mood instability, lasting fewer than a few hours. They may be very happy 1 minute, but a very small action may completely throw them into a downward spiral in just a couple of hours. 7 is chronic feelings of emptiness. They do not feel that anyone understands them, and they find it really difficult to create those true relationships with people. 8 is intense anger and difficulty controlling it. As we discussed earlier, people with BPD have very intense emotions and they just can't control it. It can often get out of hand. And 9 is severe dissociative symptoms or paranoid ideation. So, where does it come from? Well, BPD comes from biological and environmental factors. The genes that make someone more susceptible to PD doesn't necessarily mean that they are guaranteed to develop BPD. There are just some observed genes that are a common denominator of some people with BPD, but nothing is exclusive. And it also doesn't mean that someone without the gene can't develop BPD. So it's it's not a huge exclusive finding, but there are some observable commonalities. And some interesting biological findings are observable differences in the brains of people with BPD and how they relate to or how they react to negative stimuli. I'll show an image in a second showing these distinct differences in brain activity, and the amygdala struggles to contextualize these situations that they're in, and uh, and then they hyperreact to situations, and that makes it hard for them to regulate their emotions. And then from an environmental standpoint, there's a strong correlation between childhood PTSD, emotional abuse, sexual abuse, and abandonment, and the people who have BPD. Of course, not everyone who experiences these events will develop BPD, but a lot of people who have BPD have troubling childhood experiences. Most people will have observable and diagnosable BPD by their late teens or early 20s. They also notice that a lot of people with BPD come from parents or families who uh, do not properly show their emotions either. They might be neglectful or dismissive of their child's emotions, and that can create BPD. So here's the image that I was just talking about that shows the differences in brain activity. On the top, you can see people who do not have BPD, and on the bottom, you can see BPD patients. Um, it's clear that the BPD patients have much more activity in response to the stimuli listed on the top, such as neutral, happy, sad, or fearful. So these reactions are what the scientists measured when these patients or subjects were shown images that should have been neutral, happy, sad, or fearful. And this image is from a psychiatry textbook, and I'll provide references at the end of the presentation. So how is BPD treated? Historically, BPD has been viewed as difficult to treat in the mental health professions, but more recent studies have shown a very effective evidence-based treatment. It helps reduce the symptoms and improve their quality of life. And the most common mode of treatment is talk therapy, specifically dialectical behavior therapy, or DBT. And DBT is a form of CBT, or cognitive behavioral therapy, that was, and the DBT was developed by Marsha Linehan for actually treating BPD. So it's very specific to this illness. This therapy helps clients recognize their thoughts and emotions and encourages them to practice mindful regulation of their behavior. DBT has proven significant results in reducing psychiatric hospitalization, substance use, and suicidal behavior. And sometimes medications will be used to treat some of the BPD symptoms, such as anxiety and impulsivity, but this is just to treat the symptoms. There is no cure for BPD. So some cultural implications. About 3/4 of all research on BPD has been conducted in westernized countries. This creates severe implications in terms of understanding what BPD looks like in other countries, such as Eastern countries like China and India, since abnormal personality functioning looks different in different cultures. Recent studies suggest that culture and social norms are two critical factors in determining BPD in Eastern countries. For example, cultural norms teach us how to respond in emotional situations. We cannot apply Western culture norms when diagnosing BPD in outside cultures. It's important to note that more studies investigate the prevalence and how BPD presents itself in other countries or cultures. A lot of people in outside cultures might technically meet the criteria for BPD, but maybe in context, it's actually acceptable to act that way in their society. Or maybe that they developed BPD from how they were taught to react. So there's a lot of things. Always take their culture into account. So, since BPD is such a complicated illness, it can be very triggering and a difficult diagnosis for someone with BPD to be confronted with. And since a lot of people with BPD become suicidal at least once in their lives, it's a major ethical consideration that clinicians must take when treating someone with BPD. You don't want to send a potential client into suicidal behaviors, so you have to make sure that when they find out that they have BPD, that they're in a relatively stable state. And if they do become suicidal, clinicians must also ethically consider at what point they should involuntarily hospitalize their patient. And since BPD or patients with BPD struggle with interpersonal relationships, the therapist client relationship could get a little bit complicated. Clinicians must take caution and ethical steps in maintaining a safe and professional relationship with their client. Sometimes these relationships can get out of hand, but according to the American Counseling Association Code of Ethics, therapists are allowed to terminate therapy if they ever feel that their safety is in danger in the presence of the client. So, in review, some of the major characteristics of BPD are impulsivity. They struggle with damaging impulsivity like gambling or risky sexual behavior, suicidal behavior such as ideation attempts, and high risk of execution. They struggle with fear of abandonment, even if it's just perceived and not truly at risk of abandonment. And they're unstable. They often have uncontrollable emotions. And as we went over earlier, no identified traits guarantee BPD, but some genes increase the chances of developing BPD. But it's definitely highly environmentally impacted, and there's many correlations between childhood trauma and BPD. And it's treatable with DBT, and medication. And overall, borderline personality disorder is a very serious illness, but with the proper treatment and care, people with BPD can learn to manage their emotions and live normal lives. Thank you. And since this isn't a live presentation, if you have any questions, you can reach me at my email at swheeler1@alliant.edu. And here are my references if anyone would like to research some more about the facts and numbers that I presented. Thank you and have a great day.